Hi, my name's Nitesh, a GP here at 21D, and today I just wanted to talk to you a little bit about supplements, if you haven't guessed from all these things here. Now, there are so many supplements on the market. I mean, whether we talk about protein powder, protein bars, vitamin D, omega-3, magnesium, I mean, the list goes on and on and on. Now, obviously, they all promote their health benefits. Some will come with drawbacks as well. And it is just about working out what's right for you. And hopefully this guide can help with that a little bit. This is just for a bit of education. This is not personal medical advice, and everyone is different. Everyone reacts differently to any tablet that they're given, whether it's prescribed, whether it's supplements. And, you know, with each brand, quantities vary. So whether you think there's a certain amount of a certain ingredient in one tablet versus another, they may be completely different. So it would be important just to keep with that brand as well if you found something that particularly works for you. Any supplements, you just need to be careful with liver disease, kidney disease, thyroid disease, any autoimmune conditions, because they can affect the functioning of any of these organs. So it would always be worth checking with your GP, who has your regular history, just to confirm that these supplements will be okay for you. Firstly, I want to talk about protein. Now, that could be protein powder or protein bars. Now, there's so many different brands on the market, so many different styles and ways that you can get it. Now, the best form of protein will be in your food. It always will be, but there are supplements that help, as you can see some of them in front of me. And it can help you make you feel fuller for longer, and therefore you eat less. It can help for muscle recovery, but it isn't without its drawbacks. Protein is still calorific, and the calories can quickly add up, particularly if you're having it with milk. And people sometimes don't add that into their general calorie consumption because it's a drink and a supplement. But actually, one portion of this can be 100 calories if you have it with water, and then milk itself can be an extra 150 calories. So it's worth just checking how many calories you're having, particularly if you're having it for weight loss. It can also lead to stomach problems, particularly bloating and diarrhea. Or if you have a lactose allergy, it is worth checking what they have in them, because some supplements do have some lactose in them. You really should be careful with any supplements, particularly with kidney problems, if you're having a lot of protein. It can cause more kidney damage. So do be careful with how much you have, and please do speak to your GP if you do have this problem. One important thing to note is, despite all the supplements, despite everything that's on the market, one of the most important things is none of them will replace a good, healthy, balanced diet. Now, I'll talk about that more in another video, but a lot of these supplements help replace generally poor nutrition. So it is worth just trying to optimize what you're eating as well, if you do choose to take some supplements, as well as a supplement. Next, I wanted to talk to you about a multivitamin. Now, these are very popular supplements, and they can help bolster a natural, well-balanced diet, but they aren't a replacement for this. They can help if you're having a particularly restricted diet, or in some older adults who aren't getting their full nutrition. The main downside, if you have too much of a supplement, it can be harmful, and that could be something like vitamin A in pregnancy. So it is worth, if you are going to take one of these, exercising caution and just double checking with your GP. Next, I wanted to talk to you about vitamin D. Now, vitamin D is probably one of the more common supplements that people take, and actually for good reason. We get vitamin D from sunlight, and in the UK, as I'm sure you're aware, we don't get much of it. And so the guidelines are actually to take 400 units every day during the winter and spring months, because we don't actually get enough to generate our own. And vitamin D is very important for good bone health, and a few things that work in your metabolism. So I would advise actually everyone to take it in the winter months. And if you do have darker skin, it may be worth taking it all year round. Another supplement is omega-3. Now, I know a lot of people take this for their heart, for their joints, just to help reduce inflammation, but it's not a must for everyone. Again, I'm sure you've heard me say, it isn't a replacement for a balanced diet. Actually, you can get a lot of omega-3 and omega-6 in fish, and so if you do have a diet with a good amount of fish in it once or twice a week, you probably don't actually need any omega-3. One of the downsides is that it may cause you to have some burps, which may not be too pleasant, and it can affect your blood thinners. So if you are taking blood thinners, do ask your GP first. Probiotics. Now, you're seeing a lot of them on adverts these days, and I'm not naming any brands at all, but they often claim that they'll help with your gut health, help keep you regular, help keep your stools nice and soft. But the summary from the NHS is actually pretty fair, is they may help in some cases, but there is very little evidence for many of their health claims. I'm not saying don't take them. I'm saying if you find that they're helping for you, then they can be good. But a lot of them you will get through your natural diet. And actually, probiotics in these particular yogurt drinks or any way that you take them only actually have 1, 2, I think maximum 6 different probiotics in one drink. Now, if you actually had food like kimchi or sauerkraut, which generally are fermented foods, you can actually ferment them at home if you really want, but they have hundreds if not thousands of different bacteria in those types of foods because of the way they're made, and they will help your gut just as much, actually, if not more, and they will help regulate your body's natural defenses. What I would say is for any particular probiotic or anything, try it for at least 4 weeks. And if you're not finding any help, then that's fine, try something else. But they can cause things like gas, bloating, and if you are severely immunocompromised or have some critical illness, then it is definitely worth speaking to your doctor before you're thinking about anything like this, because they do all contain bacteria. So we want to try and reduce any risks of infections. Next, I wanted to talk about creatine. Now, creatine is actually one of the best studied sports supplements, and you can see it right there. There are many brands of them, and they all have different makeups. So one creatine might actually work better for you, whereas another brand of creatine might work better for someone else. Now, it is particularly good for those who are working out a lot or particularly performance athletes. But taking too much can cause serious harm to kidneys. And I've seen that when I've been working in a hospital with someone who actually ended up in severe kidney failure because they were taking too much. So it must be used with caution. And actually, if you do have any kidney problems, do speak to your GP first. But it can help with muscle gains and actually recovery. So it's not all bad, but do take any supplements, particularly creatine, wisely. Next, I wanted to talk a little bit about pre-workout. Now, I know a lot of people take this before they go to the gym, and each pre-workout, again, has a slightly different makeup. But one of the key elements in every pre-workout is caffeine. Now, you may have seen an earlier video when I talk about coffee and caffeine, and this is similar. You just need to be careful how much caffeine you're having in any particular day. The same real side effects of pre-workout are the same as those with coffee. So you need to be careful of having palpitations, increased anxiety, increased sweating. It can raise your blood pressure. So you just need to be aware of how much caffeine you're having in any particular day. If you're going to the gym in the evening and you're taking your pre-workout just before you go to the gym, you probably will find that your sleep is being disrupted. And you might think, oh, it's because I'm working out late at night. But it may also be because of the amount of caffeine that's in these pre-workouts. So it's definitely worth checking how much is in there. There is also a blend of other vitamins and supplements in a lot of these. So if you're taking it in combination with other supplements as well, it's worth just checking you're not having too much, because it can affect things like your kidneys and your liver. So it is worth just checking individual ingredients. If you are having anything like palpitations, increased anxiety, if you're pregnant, then you must stop these straight away and get some medical advice. And overall, just check your total caffeine intake and any extra additions they have in there, because you might find that it can be doing more harm than good.